when people need care at home, they get the care package.
They're going to pay for that.
And coming from Canada, I thought a care package meant somebody baked goodies and left it on their doorstep. Care packages in Canada.
And this is why I say the precious NHS has to be taken out of politicians. Every time there's a plan, and this is the downfall of any government with a 10-year plan, it never goes to 10 years. We want a system where elderly people are not in the NHS on a bed when they're well enough to go home but can't because there's no social care.
They all need staff.
Or it isn't going to work. Every one of us should care about social care.
Mm-hmm.
It shouldn't rely on unpaid carers who have to leave the workforce.
Mm-hmm.
You are holding up a system that should be holding you.
Stories, labels, misconceptions. NHS remains a blessing. Created in 1948. We want it to remain great. A podcast where we share our stories, explore solutions in all their glories. They say it's broken, but it's not done. With your hosts Val, Barrett, and Dr. Jeremy Anderson.
Welcome to Stories, Labels and Misconceptions with Val Barrett.
I'm Dr. Jeremy Anderson.
And this week we are going to be talking about the new National Care Service. And the question is, can we really fix social care?
This is very exciting, Val. We've been talking about for a long time on this podcast is the need to fix social care.
Exactly, because I'm Miss Mona. I moan about the lack of social care and the fact previous governments haven't got a handle on it. And then I read about this commission.
Yeah, I missed the announcement. So apparently Western made the announcement that there's going to be this National Care Service. I actually don't know enough about the current system. It's opaque to me because I have no experience with it. When people need care at home, they get the care package.
They're going to pay for that.
And coming from Canada, I thought a care package meant somebody baked goodies and left it on their doorstep. Care packages in Canada.
I would not pick up anything off the floor that had edibles in it.
People use the term a package of care or a care package. The system in this country is local, council by council. They offer a certain amount of support for people with certain kinds of needs.
When you own property, parents usually want to pass it on to their children. That's the usual thing.
Sure.
If they need care, i.e., if they're unfortunate enough to get dementia, or they have a stroke and they need to go into a home, when that house is sold off, money is taken away from that property to pay for their care. As far as I know.
Okay.
That still happens. For those that don't have a property, there is some care available.
Yeah.
There's care and there's care. I remember looking for my dad. We went to a few places. You had 5-star. They had a restaurant, cinema, bar. So nice. And then a 1969 care home, old-fashioned, basic, not pleasant.
What's the difference between 5-star care and the old-fashioned care home?
I imagine it's the difference between the NHS and private healthcare.
Okay, if people can pay to get good care, whatever's provided by the local council, it's mediocre.
I'm not going to say the actual hands-on care is going to be better or worse, because we shouldn't look at that as if just because it's in a very cheap basic care home versus a care home that a lot of people can pay for, like £1,000 plus a week.
Sure.
that the care is going to be any better, because people are people
Mhm.
wherever they work. But you're more likely to go out on better trips. Your surroundings are nicer. Your rooms are nice. Just nice.
Yeah.
What's the word?
Oh,
Aesthetic.
aesthetically?
Yeah.
Yeah.
It's modern. Do you know what I mean?
Sure, but no matter how modern it is,
Yeah.
the care is substandard, and you have, like,
Mhm.
disabled people sitting in, dirty diapers for hours.
When are you going to integrate into British society? How long have you been?
What?
How long have you
What's
been here?
what's oh, I'm sorry, I should have said nappies?
Yeah, come on.
Okay, so a nappy just completely full, marinating in your own urine,
Oh,
that's what we're talking
God.
about, right?
Don't give me that image. It's not the one I want to be. Take, for instance, the food.
Yeah.
If you look at some private schools, their menu is restaurant food.
Yeah.
And then you look at a state school, the menu's just basic.
Mhm.
Yeah. Even the food's different.
Oh,
But we're always going to have a two-tier system. Those that can afford vast amounts and those who can't. Not to say the care itself should be two-tier.
yes.
That we want equality across the board. Let's get into this. We know the Labour government commissioned Dame Louise Casey to lead a review on creating a national care service, a system that's supposed to do for social care what the NHS does for health. Now, this sounds brilliant.
It
But
sounds like exactly what you've been calling for, what the two of us have been calling for on this podcast. It's like they've been listening to us.
But as usual, the devil is in the detail.
Mhm.
How it's going to be paid for, because there's going to be a big cost. Who will it help? Can we afford to wait until 2026 for phase 1 and 2028 for phase 2? We can afford to wait because there's nothing here at the moment. We've waited so long for different governments when they've come in. First thing they announce is we're going to sort out social care. Then they realise it ain't that easy. At least Labour has fired the starting gun.
Yeah.
And Dame Louise Casey, she's on that case. We'll wait until phase 1 comes in, the end report next year. So today we are unpacking what this proposal really means and whether it's finally the fix social care has been promised for decades.
So they haven't figured out all the details yet, but they have a framework of different phases they're going to introduce.
As far as I know, there's 2.
Okay.
And like I said, phase 1 is next year. Phase 2 is 2028. Let me see what's going to happen in phase 3. So they want it to be a 10-year plan. So the 10-year plan must be delivered in 2026. However, the Department of Health and Social Care remit makes clear that the first phase of the Casey Commission's work in 2026 must set out a plan for reforming adult care over 10 years. With phase 2, they're making longer term recommendations. The worry I have for this is when we have elections.
Mhm.
Unless you, the government, are guaranteed to stay in power for the next 10 years, that's unlikely to happen. So would that mean when a new government comes in, because we've been told that reform likes the American system, would this be all scrapped? And this is why I say the precious NHS has to be taken out of politicians. Every time there's a plan, and this is the downfall of any government with a 10-year plan, it never goes to 10 years. I think the most you can do is a 3-year plan, which isn't much, but at least then it's guaranteed to be done while you're in government.
Hmm.
Instead of promising this, knowing you might not be around to foresee it, and
Right.
the next government can just scrap it.
Yeah.
I want government to be smaller. I want things like this to be independent of any government. It's way too important to keep swapping and changing, things starting, things stopping. Another government say, we don't approve of that. So I don't know.
Some people say the NHS or National Care Service is government. So when you want government smaller, you're not saying you don't want these things. You
Oh no,
want them
we
to
want
not be
those
government.
things. I just don't want them to be the political football. Health is so different. In
Mm.
some cases, you are messing with people's lives.
Hmm.
People not getting diagnosed earlier with
Hmm.
cancer, not getting their hip replacement. Let's get back to the plan. The department has asked the Casey Commission to consider older people's care and provision for working age disabled adults separately, recognising these services meet different needs. I'm glad they've done that because they are different needs. Not everyone can fit into one box.
Right.
It's not clear whether this
Yeah.
heralds a plan that would initiate a more formal split between the two types of service currently delivered under a single system
Hmm.
operated by local authorities.
Right.
The plan for the Commission's 2026 to 28 work is briefer and vague.
It seems like the details are pretty vague. What do you see as the problems with the current system in terms of the way we provide social care now? What's wrong? What are we missing? What are we lacking?
It's just not fair.
It's not fair.
What's the word? It's sparse.
Sparse?
We want a system where elderly people are not in the NHS
Yeah.
on a bed when they're well enough to go home, but can't because there's no social care.
There's no social care. I heard about a patient this week just discharged from hospital
Mhm,
after multiple surgeries. They need several people per
mhm,
day,
mhm.
but that's going to drop off within a week or two because the system says after that amount of time, you're cut off. If you want more, you have to pay for it. How does somebody who's not working, who's disabled and has
No.
surgeries pay for it?
Mhm.
They only get a carer coming in 3 times a week?
That is what the commission is going to look at,
Yeah.
I
Okay.
hope. Something's not dissimilar to the NHS. We
Hmm.
pay money towards the NHS. Whether you use it
Yeah.
now or not, one day you might.
Yes.
It's about creating something similar, a separate pot, not the same pot, a separate one. Because it's going to have to be the service is different. In
Hmm.
some cases, the service is about keeping people well and out of NHS,
Yeah.
receiving them from primary care so
Yeah.
they can recuperate and get better, but
Yeah.
also to keep them at home. And
Yeah.
you've got carers that may need a break. You've got the elderly that don't need hospital care but can't live on their own,
Right.
but don't need a home. Do you
Hmm.
see what I mean? That middle bit where you can't be alone, don't have to be in a care home, but still need somebody coming in.
Right. Right.
Be interesting when we meet next week to see what's going on in other countries.
Hmm.
We could have a system where you've got some older people, they're living on their own in a big house. What about having cheaper rent if a young person can move in? There's a country that does that. Somewhere does it. I read about that. And they move in,
Right.
get cheaper rent in exchange for helping care for that person. Perhaps we need to look at options like that. have
Hmm.
cross-generation support.
Yeah.
So say like you've got care workers. Let's look at the care workers that haven't
Hmm.
been thrown out the country yet.
I was thinking about the problems, the reason we don't have enough social care.
We're going to
Yeah,
get on to
is
that bit.
we have not enough money and not enough people offering cheaper rent to younger people
Yeah.
is trying to get more people doing the work. That's one way to do it.
Well,
We don't have any details yet, but putting more money into the system is going to be important too.
services have to come under the NCS, the
Hmm.
National Care Service, care homes, home care, disability support,
Hmm.
all those. And all those won't have the same model. They don't need the same system, but they all need the same thing:
Hmm.
staff.
They all need staff.
They all
Oh,
staff, or it isn't going to work.
yeah.
It's modelled in theory on the NHS, universal, publicly funded, consistent across regions. But we know that's going to be a huge challenge given how
Hmm.
uneven the current system is. So we know that one, currently social care is run by local authorities. And we know up and down the country, the
Hmm.
care's different. So we have a postcode inequality. We
Right.
hear in certain areas, you're likely to get care. And in certain other areas, and I have the figures here, don't get care. So we will always have that from it's led by the local authority.
Hmm.
That's how it's going to be. So it's postcode luck. A national care service would aim to standardize care access, pay, and training. So, like how we talked before, that doctors and nurses that are on a register,
Hmm.
anyone that works with the vulnerable should be on a register. There's a register in Scotland.
Hmm.
They need to change the way they look at this workforce. It's a workforce that is skilled.
Yeah.
They've got to stop thinking it's unskilled and pay them better. You'd hear horror stories of how some are treated.
Hmm.
There's no national register because we know when it comes to the NHS, we know in some cases doctors might be struck off, nurses might be struck off. The same should go for social care staff. There shouldn't be any difference
Right.
at all. So the other point is Dame Louise Casey will publish initial findings by 2026 and full rollout plans by 2028. Around 1.6 million people in England aged 65 and over have unmet care needs. So
Hmm.
that's almost 1 in 8 older people. Now that's just people aged over 65. Don't forget the other group is disability support
Hmm.
for adults. Let's look at age 18 and over. You've got that, or even
Right.
younger. The one
So,
because you've got a group that don't live at
yeah,
home. So we've got to look at those provisions as well.
yeah, people working in social care,
Mhm.
support workers, is there currently no standard or training required or certification?
I
Is it,
imagine there is. We talked about this before. I couldn't find it.
obviously, people need their DBS, like their criminal record checks and
You
certain
would hope
things.
so.
Yeah. But in terms of trying to attract people to an occupation, you want to give it a status, better pay, better.
Now, I remember we talked about this
Yeah.
before. Scotland has that,
Okay.
but England doesn't. When we had an episode about social care,
Hmm.
we noticed Scotland seems to have a better plan. There's a recognised qualification
Hmm.
and a register. Wales might have something as well.
England is lagging behind.
Yes. unfortunately.
Does that mean care workers in Wales or Scotland are paid better? Are they?
Don't know
Yeah,
about the pay.
yeah.
But when it comes to standard, we hope
Hmm.
there is a decent standard throughout,
Right.
regardless of pay.
Because if you're doing an occupation, anyone can do it with no training. They just say, okay, go and, I don't know, wipe this person's butt or something like that.
Mhm,
Right.
mhm.
That's not a high status occupation. Those people get paid very little money.
Yeah.
They get paid minimum wage. But the
Mhm.
idea is if in order to do that job, you have to have completed certain courses, certifications, qualifications, background checks, you demand a higher wage. As you demand a higher wage, that occupation
Mhm.
is viewed as a higher status. It becomes more attractive. Do you want to do something for minimum wage or invest in something that's going to get you paid quite a bit more,
Well,
right? That would
apparently,
attract people
yeah,
to the profession, right?
of course, we want that to happen.
Yeah.
But it's one of the lowest paid sectors in the country.
Hmm.
And the turnover of staff is almost 30%. That's
Hmm.
high,
Yeah.
very
And,
high.
and I wonder what kinds of people do that job. Low paid, no
Immigrants,
qualifications.
remember, until they decide to get rid of the social care work visas. I'm
Hmm.
telling you now, they're going to have to get them back. Social care is only going to get bigger. If we seriously want to be a nation where we're talking about health,
Hmm.
talking about well-being, we're talking about keeping people out of the NHS, which is a good thing. That's a good
Hmm.
thing. Then these people need to be taken care of in social care. We talk about mental health.
Hmm.
That should be down here.
Mm.
Shouldn't it? Mental health.
Yeah,
Because
that's a good point.
that shouldn't be dealt with in the NHS. Not in A&E. I've seen it
No, not in
happen.
any. No,
Seen
not
it.
in A&E.
They
No.
so really should be part of this big social care plan. Just like you have a bag of all sorts in the
Yeah.
NHS, but the NHS is streamlined. You've got hematology,
Hmm.
urology,
Hmm.
cardiac. So you've got all those departments
Hmm.
and people that work in them specialize in those areas.
Yeah.
What is the National Care Service going to look like? Because you're going to have people that are experienced and qualified in dementia care,
Yeah.
stroke care.
Yeah.
You're going to have mental health services. They're going to have to be better. There's going to have to be
Yeah.
more.
There's going to have to be a continuing education or professional development where people
Oh, yeah.
enter at a certain level, get experience, specialize, do
Mhm,
training,
mhm,
and command a higher wage because they have that experience and that training. And I think the kind of professionalizing the sector is what's needed. Now, all that means that we end up paying more for it. If we step back and take like a
mhm,
bird's eye view of the society, we've got certain things that people say they want or they don't want that it doesn't really jibe, right? If you don't want to pay high taxes,
mm,
if you don't want to provide these services, we have a demographic problem. We don't have younger people to take care of older
exactly.
people. We have a huge demand. If you don't want kids and you don't want high taxes, that leaves bringing people into the country. But if you don't want immigration, we have to find a way to provide care in a way we can afford. Either the people here have to
Mhm.
do it or we have to bring more people in.
We know the service is already stretched, and I don't believe you can reform a service as big as this that is going to grow and grow without talking about raising the standard.
Hmm.
It's got to raise. There's no ifs or buts.
Hmm.
Because if you want it to be an offshoot, I don't know the word, if you want it to replica the
Hmm.
NHS, then you have to look at everything that you have in the community. Some things don't need to go to primary care,
Hmm.
only because there's no secondary care.
Yeah.
We're going to need more community doctors, community nurses.
Hmm.
I remember when my son Andre was young, we used to have the community nurse come around to take his blood through his vortex port and flush it. That was done at home. We didn't need a trip
Hmm.
to the hospital. Not every nurse knows how to use a vortex port.
Right.
You need that expertise. Might be catheters. You think of anything else that's more
Well,
that's a nurse might need to do instead of just someone that isn't a nurse. That can be done in social care. So blood can
oh,
be taken at home.
I don't want to speak for nurses, but I can imagine lots of things done in hospital. But
Hmm.
if you had someone with the requisite expertise and they could do that in the community,
Yeah.
it might well be more
Hmm.
efficient to do that in someone's home
Hmm.
where it's not a big hassle for them. They don't miss appointments. They
Yeah.
don't expose themselves to infection or
Hmm.
injury or something like that. So,
I think there's going to be a
yeah.
time, whether it's today or tomorrow,
Hmm.
that people on dialysis might have to have it at home.
Dialysis is something
You
people can do
never
at home.
know. Oh, is
Um,
it?
yeah, not the hemodialysis is something that they've branched out into like
Hmm.
smaller clinics. But there's a kind of dialysis that people do called peritoneal dialysis,
Yeah.
where they have fluid going into their abdomen and it
Hmm.
flushes things out. It's not they're not dialyzing the blood, they're dialyzing through this abdominal fluid. But that's something someone does on their own at home.
Hmm. Hmm.
Um, and so it's more efficient and frankly easier for the person
Yeah.
because they have to do that 5 times a week. So what they can do is they just hook up a bag and it goes by gravity and they just sit there for 30 minutes or an hour
Hmm.
until it drains in. And then they leave it in for a few hours and they drain it out.
Yeah.
Patients can do that themselves. More stuff like that where people can take care of themselves in the community or have someone come in and take care of them
Yeah.
without needing to go to hospital
Yeah.
is definitely a good thing.
But when we talk about the workforce in social care, there's 152,000 vacancies.
They can't
That's a
find people to do
lot.
those jobs.
Some people don't want to do it. It's not just can't, won't.
Hmm.
But people that came into the country to
Hmm.
do jobs like that, they no longer want them. So what are we
Right.
supposed to do?
Make those jobs more attractive, right?
I don't
I
think it's just that. Cleaning someone intimately, you can't dress that up. No, it's not just
Yeah,
about that.
yeah,
If you're going to work in care or be a nurse, it's something you want to do,
yeah.
regardless of the pay. It's
Hmm.
something you really want to do.
Sure.
Some people do it
Hmm.
even when the pay's low.
Yeah.
Then,
Retaining people, right? People don't like their job, but can't give it up because the pay is good.
yeah.
That wouldn't be the worst problem. If you had this care sector so well paid that vacancies were filled because
Mhm,
people
mhm.
really wanted to keep those jobs, that would be really good.
At what
Right?
cost?
It,
Is
it would
absolutely.
cost. Yeah.
No, let's say the pay attracts anybody
Hmm.
that wants a job.
Yeah.
But does that mean you keep that person, even though they hate it, show they hate it,
Hmm.
and they're not doing the job well? Does that mean you keep them on because there isn't anyone else?
No, obviously, if someone isn't doing the job,
Hmm.
then it's not the right job for them.
Not just the pay. It's
Yeah,
the conditions,
yeah,
it's the hours.
yeah. I wonder if someone was given a really good wage for that job, would that make you like the job more?
No.
W- You don't think it would change your perception?
Nope.
No,
No.
I think
Money isn't everything.
I'm
It
well.
is when you want
No,
your bills paid.
no. Of course, money isn't everything. I recall this one guy in a clinic I worked in back in Canada who made a lot of money with a tanker truck. He would suck up whatever fluid people needed. So he would empty septic tanks and But it wasn't just that. And he was like, no, it's not just poop. Everyone just thinks it's poop. It's not. He would get rid of anything. It's a job nobody else wanted to do. But it's a fairly simple job. And
Mhm.
he had the equipment and he could charge whatever he wanted. He loved his job,
But that's
right?
different. He
Yeah.
could charge whatever
He
he wanted,
charged.
and it wasn't really a hands-on job.
It was hands on because you got to put the tube in the tank. You
The
got it.
tube at
Yeah.
Tube.
Yeah.
Other than that, he didn't have to clean anyone. Just him, his truck, and a tube.
Yeah.
That's different.
Yeah.
We're talking about people that have to work and communicate with vulnerable people.
Yeah.
Some
That's
people
definitely a
that
skill
may
set.
have
Not everyone has. Yeah.
dementia,
Uh-huh.
where 1 minute they're okay, next minute they may lash out. Dealing with people that have had strokes that can't verbally communicate. You've got to have a variety of skills. You can't have someone there just for the money because they don't understand or hasn't got the patience to. They take it out on that patient. No. These people are vulnerable enough. Someone that wants to do it.
Yeah.
Yes, the pay should be better, but no one should take the job alone based on the pay. I don't believe for one moment that a nurse does nursing because the hours are great and the pay is the best ever. The conditions are brilliant. I don't believe that for one moment. People get into nursing because it's what they've wanted to do. It's a
Yeah.
vocation. It's not because if it was down to the pay and the conditions and everything else, we would hardly have anybody. They're
I
on
think
their
actually,
feet for a lot of
yeah,
hours.
there are people who, when they think about career, do think about the money, right?
Okay.
If nursing or care professions are well paid, those professions become an option for someone's interested in a decent wage, right?
I don't know.
Think so?
I'm not the psychologist. I might need one after this.
You don't think people do that, or you don't think people
No,
should?
people do. You've known me a while.
Yeah.
I'm not a horrible human being. But there's nowhere on this earth would I be a nurse. No matter what amount of money they offer me.
Yeah. I'm not suggesting that just because they increase the salary, it would become an option for everyone.
Exactly. It's
like-
not.
Okay. If we circle back to social
Really?
care, we've got 150,000 vacancies, right?
52,000.
If there was a government program that doubled the salary for those vacancies, do you not think we'd fill them?
There's so much more the government needs to do to make this sector more attractive. They don't fill these vacancies.
Mhm.
The reliance is going to be more on people like me, unpaid carers,
Yeah.
who may have to leave the workforce to care for loved ones. We already know, I'm sorry if I'm going on about dementia. We already know that there are some needs that once they get to a certain level, you need somebody qualified that can care for that person.
Yeah.
When
Yeah, of
family can't, not because they don't want to, because they can't. I've watched a few people with it. It's just different. It
Yeah.
breaks their heart to say, I can't cope anymore.
Yeah.
No.
What would make a job in the care sector more attractive?
It's got to have appeal. It's got to have,
Mhm.
somewhere you can go within that sector.
Job progression, right? Like a
progression.
sense you're always
Yes.
learning, developing
Yes.
yourself.
But you can move
Yeah.
up.
You can
or
move up.
out.
Yeah.
Like I said, I think the whole of social care, the structure needs to completely change. You'll have the social care staff, then you'll have palliative care nursing,
Mhm.
because you've got that sector as well. Don't forget, that's in social care.
Yeah.
Then you'll have nurses, staff that specialize in dementia, stroke, mental health,
Yeah. Or
community-
developmental
yeah.
disorders like
Com-
autism.
community nurses, community doctors. So it becomes like a mini NHS in the community.
Hmm.
The system that is fair, whether you are in SW10 or in the north of England. It
Sure.
shouldn't matter. You
Yeah.
get that same level of care because people are paying the same level of money
Hmm.
into the system. And part of that is you need the right
Yeah.
workforce, and getting rid of the visas,
Yeah.
that's going to haunt them. It
Yeah.
really, and that tells you how much they think the
Yeah.
social care sector,
Hmm.
because whether you are a recipient of it today
Hmm.
or tomorrow, a family member might be, you might be, but it's something that all of us, whether we're physically fit now, we're running marathons or whatever, every one of us should care about social care.
Hmm.
We're living longer with illnesses that people used to die from 30, 40 years ago. It shouldn't rely on unpaid carers who have to leave the workforce.
Hmm.
Sometimes their relationship breaks down, their marriages do,
Sure.
because they're caring for a loved one, because there's nowhere to put them,
Hmm.
and they don't have the funds. They don't
Yeah.
have the money, yet that loved one worked all their life, paid into the system. You had a generation where, I think it was Winston Churchill, one of them said, they would be cared for from cradle to the grave.
Hmm.
And unfortunately, that's not happening. I dread to think that if they don't reverse this social care visas, more adults will leave the workforce to care for a relative, because it's going to be them to carry the can,
Yeah.
because the government has not readied this social care. We've been waiting for years, and I still think it is going to take a long time. But let's look at what Scotland are doing. So we know that Scotland is already trying
Yeah.
this.
Okay.
They've been building their own national care service since 2022, but it hasn't been smooth sailing. Nothing new is.
No.
You don't expect it to. So the key points are delays and rising costs have
Hmm.
led to criticism. Questions about whether centralising care actually improves outcomes. We can discuss that. Thirdly, carer groups worry about bureaucracy
Hmm.
overshadowing person-centred care. So what do you think about centralising care actually improve, whether they believe it does improve outcomes?
Centralizing anything sounds like a good idea if you have a smaller number of people kind
Uh-huh.
of at the top controlling things. You should be able to get something done,
Mhm,
right?
mhm.
But that comes at the cost of local solutions for local problems. Understanding the needs of the people in a particular local area might have different needs than somewhere else. Having localized
Yeah.
control gives you more flexibility.
Yeah.
So, so I suppose there is a bit of a trade-off between kind of the equal or standardized care versus the flexibility to give people what they need.
Perhaps it needs to be localized.
Maybe, but
Each
the system we have now is localized, right? It's the local council that
Yes,
does
but
stuff, right?
they're the ones that dictate how it's done.
Hmm.
The framework is delivered from the Department of Health and Social Care.
Yeah.
This is a framework you have to follow. Each local authority should know their needs are
Hmm.
in their area. So Kensington and Chelsea might have more people with mental health issues than Hammersmith and Fulham. No point in over flooding it with something else. A national framework,
Hmm.
funding, and support for local authorities when it comes to funding, staff, a model, training. So wherever you live,
Hmm.
up and down the country, everyone's trained the same.
So national
There's a
standard.
standard,
Yeah. Okay.
there's a register, but each area has its own low plan. Do you see what I mean?
Yeah.
Because that's the only way to improve the outcomes in an area. If you're delivering something that the area needs, does that make sense?
Yeah.
Yeah.
Oh.
Learning from Scotland is good because they've gone through it. They started it in 2022. The Scottish experience shows a tension between national consistency and local flexibility. If England copies the same model without fixing workforce pay and funding, we'll just have a new logo, not a new system.
Exactly. Yeah.
It's not going to be easy.
No.
By far, this is one of the hardest things any of the government has
Hmm.
had to do, which is
Yeah.
why they haven't. Because
Yeah.
if it was easy, they would have done it. They always go for the easy thing. Let's chop away benefits, but not build a new social care system. At least the firing gun has started. Once you start, it can be built upon. Look at other models. Look at what has worked well and what hasn't worked so well. Because we know it's like an NHS trust. Each trust.
Yeah.
We've got the NHS and soon the NCS. Yay!
Fantastic.
Let's have a look at the psychological and social impact.
Okay.
For people who rely on care and those who provide it,
Hmm.
this uncertainty takes a real toll. There's no labour, financial pressure, and constant anxiety about whether support will continue.
Hmm.
And we know that.
Yeah. Enormous pressure on families when you're trying to care for a loved one, either like a parent who's got dementia or someone else in the family who's disabled. The impact on just time and finances and uncertainty isn't stressful. I was thinking, I can't remember where I heard this. There was a study a few years ago looking at happiness and income. And what they found as income goes up, happiness tends to go up. They say money can't buy happiness, but
I
apparently it
know.
can.
Let's give it a go.
Yeah.
Give it a
So,
go.
but at least up to a certain point, it's basically where
Hmm.
you're not constantly worried about having enough to pay the bills.
Exactly. Yeah.
You don't have to be filthy rich, just rich enough that
Where all your bills are paid.
where you're not always thinking about money. Right? If you're in a family where a care need comes out of maybe you weren't expecting, or even if you were
Mhm.
expecting it, and someone has to leave their job to care for mom or dad or whatever, that puts an additional financial burden
Mhm, mhm.
on the family. Aside from concern about the family member and care, there's a new concern about, okay, what about, are we going to make it? Are we
Yeah.
going to pay the mortgage or pay the rent?
Yeah. And as we are stressing more and more in society about bills, because it's why I can't stand it when people say money's not everything. It is when you've got a letter saying if you don't pay your rent, you're going to be thrown out.
Mhm.
Says the person with money in their nice house. It's only people with money that actually say that, but because they forget the time when they didn't have. You
Yeah,
understand?
yeah.
So when it gets to the point where you are working so hard and you've got nothing at
Mhm.
the end of the month to show, that must be shit.
Yeah,
What the hell am I doing?
money's not everything, but it is quite a bit.
Don't say that. I'm going to be different. Money
Yeah,
is everything.
money is everything. Yeah,
If you think it's not, give it to me and I will show you it's everything. All
yeah.
right? So,
You'll be happy to be proved wrong, maybe? Prove me
driving in
wrong.
my Ferrari.
Yeah, being an unpaid carer is not just about the stress of caring for the person. It's
Mhm.
everything else that comes along with it. Everything's connected.
Exactly,
Yeah.
Dr. J.
Mm.
Okay, let's finish.
Okay.
I'm just going to do a misconception.
Yeah.
One of the biggest misconceptions about social care is people think it's only about the elderly.
Hmm.
In reality, half of social care spending supports working age adults with disabilities or mental health needs.
Half. Fully
Half.
half. Wow.
Yeah.
Okay.
What's your misconception?
I think you pointed out a good one. Social care is not just for the elderly, it's for people right now. I think misconception. I was thinking about this idea that at the moment, we're not attracting enough people into these roles
Mm-hmm.
despite the need. And so for a long time, that was something that we had immigrants do. And I don't know if this is so much of a misconception, but I wonder if just my own experience with the immigration system,
Mm-hmm.
when you come to this country to work,
Mm-hmm.
you're required to work in the job you applied for the visa under. You can't change,
Oh, I
right? But
didn't know
it's
that.
as you live and work here,
Mm-hmm.
and if your status changes once you get indefinitely to remain and you're not applying for visas, now you have a choice. You don't have to stick with a
Really?
specific
I didn't
employer.
know that.
I can imagine there's lots of people who come to this country, or at least when they had the social care visa, who you might think they're doing this because they love working in social care, but maybe they don't. Maybe they don't have a lot of choices, right?
Don't know.
For people from some countries where people routinely
Mm.
go abroad to send money back home,
Yeah.
the local training, you might only have a choice of becoming either a nurse or a maid or a custodial worker,
A
right?
maid.
Yeah.
It's a bit old fashioned.
Okay, we can edit that.
Yeah.
What's the modern term for that? Like a house cleaner, right? Um,
It's a fact you used the word maid. Oh God.
yes,
Um,
this adventures in cross-cultural linguistics.
do you use
But
that in Canada?
oh yeah, yeah.
You're kidding me.
I was thinking there's a lot of people who do these jobs, and they don't have a lot of choice in the matter. It's just this is what their opportunities are. But once people get choices, once they have the means, maybe they make different choices, right? And I think we have to factor that in to whatever changes we want to make to our systems
Mhm.
in terms of providing care. We have to understand that we want to give people choices, the choice to do this job. And yeah, what are the changes that we need to make people make those choices?
There's
Um,
one big misconception I thought you would have said. You mentioned it in the beginning.
okay.
Because you're new to the country and the way the system is,
Yeah.
a lot of people think, even those born here, think the NHS covers care needs. It
Oh, that it,
doesn't. Social care is means tested
mm,
and is completely separate from the NHS.
yeah.
And some people don't realize that until they need to access it.
I experienced it this week hearing about a patient who was under NHS care. When discharged, they were told they weren't going to get sufficient care at home, despite the fact they have a pretty lengthy period of convalescence.
So that's the end for this week. So if you're like me and you've listened to this and you're caring for a loved one, please know your effort isn't invisible. You are holding up a system that should be holding you. Take a moment for yourself, breathe, rest, and remember, care starts with compassion. We know the conversation on social care won't go away, and neither should our compassion. So join us next week to talk about social care systems in other countries and see what England can learn.
Sounds great.
Yeah.
Yeah.
Thank you. Nice to see you, Dr.
Okay.
Joe Moon. It's a long time ago.
Great to
This
see you too.
Say hi,
Okay.
Junkie.
Will do.
Junkie.
Absolutely.
See,
Jean-Guy.
I'm saying it right. That name has
Yes.
to change.
Abs-
Okay, bye.
Thanks. Bye bye.